Hello, my name is Sam Ord, and this is the second part of the Imaging Principles and Technology lecture. And in this lecture we're going to be discussing harmonic imaging and artifacts. The objectives of this lecture are to discuss how harmonics are formed and their benefits and limitations associated with them. And the second part of the lecture is discussing artifacts. And again, what are they and how they're formed, the importance of their recognition, and we'll discuss the various types of them. And it won't include every kind of artifact that you've ever heard of, but the majority are in there, which are the ones that are most relevant, I think. Okay, so harmonics are all about trying to improve the image quality, and most high-end machines will use harmonic imaging to improve the quality of the display. So as a sound wave travels through tissue, it changes shape. And as the wave propagates, this change in shape happens because the higher pressure portion of the wave travels faster. Remember, you've got the compression and the rarefaction of the sound waves, and as those compressions come together, pressure will increase and that wave travels faster. And this is in part owing to the higher density as those particles come together. During rarefaction, which is as the sound waves sort of spread out, you're going to get lower pressure, and that means that the sound wave is going to travel slower in that portion. And basically, as the sound wave then travels through and propagates, you're going to get wave distortion that happens. And you can see that in the middle and the second diagram down below there. As the wave distorts, you're going to get production of different frequencies. And these are what the harmonics are. So as you're progressing from a sinusoidal to a non-sinusoidal shape of the wave, you're going to get a range of frequencies produced which are different from the original frequency, which is known as the fundamental frequency. So we describe these as odd and even harmonics, or odd and even multiples of the fundamental frequency known as harmonics. I don't know if you've ever heard a guitar player. They can sometimes just pluck the string and they don't actually put their finger over the fret completely, they just hold it off a tiny bit, and you get this kind of much higher sound pitch. It's almost like a bell ringing, and that's harmonics being generated on a guitar string. Another example of it. Obviously we're dealing with much higher frequency waves in the much higher frequency ultrasound waves rather than waves that we're hearing, but the principle is similar. So the usefulness of this is that if you've got the fundamental frequency and the the second or third harmonics that are then being produced, the odd and even harmonics that are being produced, what you can ask the ultrasound machine to do is to ignore the fundamental frequency and just concentrate on the harmonics. So this is done with band pass filtering. Okay, so if you're producing that fundamental frequency, you can see there in blue, and the harmonics that are produced, and you're picking those up, and those are in red. If you were to do band pass filtering, you can eliminate that fundamental frequency and just concentrate on that second harmonic. And this will be important as we'll go on to discuss in just a second. Before we do, I just want to again concentrate on this band pass filtering initially. Look, because the fundamental and the second harmonic bandwidths must fit within the overall sort of transducer bandwidth, it must mean that both of those fundamental and the second harmonic have got to have reasonably narrow bandwidths. Now try and remember that the bandwidth decreases with a longer pulse. Okay, so if I'm saying that I want the fundamental and the second harmonic frequency to have narrow bandwidth, I'm going to need a longer pulse. What's the problem with a longer pulse? Well, a longer pulse means that you are going to have axial resolution degradation. Because remember, it's the pulse duration divided by 2 that gives you your ability to differentiate between two structures down that axial path. If I have a longer pulse, that means that I'm going to have reduced axial resolution. And I hope that makes sense. We went through it in the previous lecture. So what's the good thing about harmonics? Well, harmonics are generally only produced in the highest intensity portion of the beam. And as you can see from the top image there, that's generally where we're focusing. If it's in there during the highest intensity portion of the beam where we're focusing, that means, and if we just focus on the harmonics from those areas, means that we're just interested in those echoes that are being produced from the area of focus. And that is going to try and improve our image quality, because at that focus zone, we are going to have a narrow primary beam that we're looking at. And what does that do? Well, that helps your lateral resolution, as well as improving your lateral resolution with a narrow primary beam. It also means that we're going to ignore some of that sound wave intensity that's going to be at the edge of our sound beam. What does that do? Well, that helps reduce some of the grating lobes. And those grating lobes were the intensity that gets sent out from the side of the sound wave. And you're also going to get reflections that are coming back from those echoes that we send out sideways. Grating lobes, side lobes, things like that. We're going to help eliminate those with harmonic imaging. And lastly, we're also going to help try and reduce some of those near-field artifacts. So that's, for instance, looking at that cartoon at the bottom, for instance, if you've got ribs in there which you're trying to image through, some of the sound wave intensity will be reflected back from the ribs. That's going to give you some of this near-field artifact. And you're going to help trying to ignore some of that, because again, we're just focusing down on that primary beam, and it's the area of the highest intensity proportion. So harmonics are all about improving your image quality. But we said that the axial imaging was a problem, and this is obviously extremely important. Well, the way that we get around this is with what's known as pulse inversion. So we said that longer pulses were needed for bandwidth filtering, and that was going to reduce our axial resolution. And that was all because we wanted to have narrow bandwidths in the of the fundamental and the second frequency, and so that we had to have that within the whole bandwidth. Well, a solution to this axial resolution degradation is to use this pulse inversion, and that's where we use 2 pulses per scan line rather than 1. If you have the second pulse, which is going to be an inverse of the first, then you add the 2 pulses together to give you that scan line. What the 2 pulses are going to do is that if they're inversed, it means that you're going to get destruction. You're going to ignore that fundamental frequency because of the 2 pulses adding together perfectly. They are going to cancel each other out. So that means that the fundamental frequency be removed, but you're going to get those harmonics are going to be different between the 2 inverted pulses, and so they are going to combine together to give you a harmonic signal. So the fundamental frequency will cancel itself out, and the harmonic frequencies will remain. So this technique is going to allow broader bandwidth. So that means that we can use shorter pulses, and that's going to improve our detail resolution. Okay? So inverted pulses means that you can have, they're going to cancel out the fundamental frequency, and means you can just concentrate on the harmonics that are produced, and the harmonics are only produced in the central portion of the higher intensity of the sound beam. Means that we're going to improve our lateral resolution, get rid of the grating lobes, and you get left just with your you're going to get left with your image at that focus position that you're interested in. Okay. But let's try and remember, what is the issue with that? So harmonics, the good thing about harmonics, it's going to improve your image quality. Well, the bad things about it, well, we have to use this pulse inversion technique. For the pulse inversion technique, we need 2 pulses per scan line. What's that going to do to your temporal resolution? It's going to decrease it. So good things about harmonics, better image quality. Bad things about it, frame rate is going to be reduced. We're going to have degraded some of that temporal resolution. This is just an example of what the harmonic imaging does. So this is on maybe quite hard to image patient in this parasternal long axis view. And on the left we can see one with just the fundamental frequency being used. And then on the second image, under image B, you can see this is with harmonic imaging, and we got reduced clutter and improved tissue resolution. And that's what it's all about, trying to get the best image that you possibly can. Okay, so that's harmonic imaging. Let's talk now about artifacts. So this is a really important concept to understand. You're going to see them a lot in your every day-to-day practice, and they love asking about it in exams. So what are artifacts? Well, artifacts are basically the appearance in the display that's not accurately representing the anatomy that you're imaging. So they're incorrect representations of that anatomy or function that you're looking at. They're important to recognize because either you need to know that they're not an anatomical process and you can ignore them completely, or they're going to be useful because you can understand where this artifact is coming from, and maybe that can help you try and make a diagnosis about something that's there. And again, we'll try and go through these with some examples. So there are three main categories. We've got one that's based on acoustic properties, which is basically the way that the ultrasound is interacting with the tissues, and this is the majority of ones that I think that we see and we need to recognize. You can, of course, get artifacts that are related to instrument that is potentially broken, miscalibrated, faulty. If you've got broken crystals or whatever, and that needs to be recognized. And the final one is you're going to see it with electrical interference. So particularly intraoperative transesophageal echo, for example, when they're doing cauterization, you're going to be seeing these huge artifacts come across the image. And those are, again, important to recognize and know what they are. So where do they come from? So the artifacts are all about incorrect assumptions that the ultrasound machine makes in order to generate the image. So the first of which, the ultrasound beam is a thin line. Well, as we know from looking at everything from slice thickness artifacts to lateral resolution, we know that the ultrasound beam is not a thin line. The ultrasound machine is assuming that each scan line is just like a tiny, thin, little bit of cotton thread that is going out in each line, and that's not the case. There is a three-dimensional structure to it, but the ultrasound machine assumes that it's just one thin line. It assumes that any echo it hears is just coming off that line, and it's not. You've got that three-dimensional characteristic to it. Hence your slice thickness artifact, your lateral resolution artifacts. The ultrasound assumes that all echoes arise from structures on that beam axis. As we discussed, you've got this three-dimensional structure. If you've got a structure that's anywhere within that three-dimensional structure, it's going to give you an echo coming back, but the ultrasound machine assumes it's just coming from that thin line. The ultrasound assumes that sound is traveling in a perfectly straight line. As we went through with refraction, for example, when you have different propagation speeds between two media, you're going to get movement of that sound wave if you're coming in at an oblique angle. Again, we'll show some images of that, but again, that's to show you that the sound wave does not travel in a straight line. And the example is obviously looking at a straw in a glass of water. It looks like it's bent. Sound wave does the same thing. The ultrasound assumes that sound travels at uniform speed. In one of the original lectures, we discussed that sound is assumed to travel at 1,540 meters per second through the tissues. And that's basically an average, and it doesn't. It travels slower in things like fat, or it travels higher in things like bone. And you need to remember that sound is going to travel at differing speed. And so this can give us what's known as depth propagation artifacts, for example, which we'll go through. The ultrasound assumes that there is constant attenuation going through all the tissues of about 1 decibel per centimeter per megahertz. We know that there is reduced attenuation if you're going through something like just fluid through the bladder or through a pleural effusion. There's going to be reduced attenuation. And there's going to be increased attenuation if you're going through something like bone. The ultrasound machine doesn't know what it's going through, and it just assumes that there's constant attenuation going through all of it. The machine assumes that all echoes received before the next pulse is emitted. We know that you're getting reflection that can occur. So you can get reflection artifacts, and these are an example of sound traveling further than the sound wave, than the machine assumes. And finally, it assumes that all echoes are reflected just once. And as we know, again, with mirror image artifacts or refraction artifacts, these echoes can be reflected at many different areas, and that can give incorrect sort of anatomical locations, if you like. And again, it's just important to be able to recognize these. So the main sort of 4 artifacts we'll concentrate on are beam dimension artifacts, attenuation artifacts, depth artifacts, and beam path artifacts. Beam dimension artifacts, we've kind of been through a bit. We're talking about the resolution, and you've got 3 kinds of differing problems with the artifacts. You've got axial resolution artifacts, lateral resolution artifacts, and slice thickness artifacts. And again, this is all to do with the fact that this beam has a 3-dimensional component to it. It's not simply a thin line. So on the image on the left, we can see that we are able to differentiate between 2 structures, 1 and 2, but structures 3 to 5, they look like they are one structure on the display, and that's because those structures 3 to 5 are too close together for us to be able to differentiate between. And that's all to do with the spatial pulse length. And again, we said the axial resolution was all to do with the spatial pulse length, half the spatial pulse length. You can pick up the difference between 2 structures in that axial format. In terms of the lateral resolution, it's all based on beam width. And so here in that cartoon in the middle, if we have 2 structures that are in fact actually separate from each other, but they are sort of closer together than the distance of that beam width, they're going to look on that image to just be one structure. And the same goes with slice thickness in terms of its elevation, and that's important to understand the 3-dimensional structure of that beam. In terms of attenuation artifacts, again, you're going to have different attenuation in different structures. So you can have shadowing, you can have enhancement, and edge shadowing. With the shadowing, so for example here, this is a lung ultrasound. We can see that we've got these very dark shadows on either side of the image there, and that's because you've got ribs that are in front of them. So the ribs, high density, they've got high attenuation, they don't let the sound wave propagate all the way through because all the energy is absorbed because of the high density, and that means you've got high levels of attenuation. So what does it look like behind it? It looks completely black. Essentially the sound wave has been sent out. You get a bright front to the bone, as you can see there in the image, and that's because you've got a high sort of acoustic impedance difference between the muscle above it and the bone. And then a lot of the sound wave energy that is transferred through is absorbed, and you don't see any reflection come back from that, so it just looks black. You can have enhancement artifacts. So here's an example of a pleural effusion, for example. And at the back, you can see that it's really, really bright. And that's because the machine's assuming that you've got this sort of standard 1 decibel per megahertz per centimeter attenuation that goes on. And it's not. When you've got this kind of homogeneous fluid there in the pleural effusion, you have reduced attenuation. And so that means that you're going to get a greater intensity to the sound wave that's reflected back. But the machine doesn't know that you've had reduced attenuation, so it hears the, it senses that intensity of the sound wave that comes back, it amplifies it, thinking that it's at 10 centimeters down the track, I need to amplify it to a certain extent, and it comes back looking much brighter. So that's all about enhancement artifacts. And finally, edge shadow artifact, and that's, again, you're going to have enhanced, if you've got a fluid-filled structure, like a blood vessel there, like the carotid artery, you're going to have fluid in the middle, that's going to lead to some enhancement through it, but the edge, you've got increased sort of density of getting that, sort of the lumen of the blood vessel, and that's going to cause some it's going to increase absorption and cause reduced increased attenuation as you go down the edges, which means reduced echogenicity behind it. And again, you get these kind of edge artifact or the shadows behind a spherical structure like the carotid artery. Well, depth artifacts. This is all to do with the speed. It's assuming that you're traveling at 1,540 meters per second. And you've got propagation speed artifacts, reverberation artifacts, comet tail artifacts, and Bringdown artifacts. The depth artifact with a propagation speed artifact, so example here, imaging through the liver. If you have something like fat, the sound is going to travel a little bit faster through there, but the machine's not going to know it, and that can lead to this kind of boundary displacement that you can see, and it actually thinks that the sound wave is further than it really is. A reverberation artifact is happening where sound sort of reflects back and forth through a surface. Here it's with a pacing wire. You know, it looks like there are 4 or 5 pacing wires in there. Of course, there's only one. And that's all to do with reverberation of the sound wave around that highly sort of echogenic metallic wire and the soft tissue which is close to it. So it's occurring basically with large reflection coefficients. A comet tail artifact is a type of reverberation artifact, but it's much shorter lived. And here you can see it in that sort of lateral tricuspid annulus. You get this kind of shadowing and this kind of comet tail artifact that comes down, which you can see as that lateral annulus moves around. Bringdown artifacts, well, these are a special type of artifact caused by ultrasound sort of bouncing between small gas bubbles. So you can get it in the lungs, like you've got here, where you've got these kind of B lines. You've got these big sort of bright shadows that sort of come all the way down. You can also see it in the bowel. And then finally, sort of talking about beam path artifacts. Well, these are sort of the refraction or the mirror artifacts that we see. And again, we sort of discussed these before. And it's when you change between propagation velocities between 2 structures, you're going to get some form of refraction happening. So that's where the sound wave either, you know, it depends if you've got the higher velocity in the first or the second structure, and that depends whether you're going to get the angle increasing or decreasing from the instant angle. And again, that's all due to Snell's law, which we discussed in the previous lecture. Here you can see the mirror artifact. So that's when sound wave will be bouncing off that highly echogenic pericardium, and it comes back. But some of the sound wave doesn't go all the way back to the transducer. It actually reflects back off, for example, the interventricular septum, then comes back down and then gets re-reflected back off the pericardium. What does that make it look like? Well, it makes it look like there's a mirror image. It makes it look like there's another heart sitting behind the pericardium, which of course there isn't. So in summary, we talked about harmonic imaging, and that's how that sound, the shape of that sound wave changes, and how that's we can use some of that information to try and improve the image quality, but that's at the expense of some temporal resolution. And we discussed artifacts, both which is the appearance on the screen that does not sort of accurately represent the anatomy that we're imaging. And that's in terms of beam dimension artifacts, attenuation artifacts, depth, and beam path artifacts, and we discussed each of those. I think the important thing to mention is that how you can recognize some of these. Obviously, they're based on some assumptions that the machine's making. You need to look in as many different angles as possible. If you've got an artifact and you're seeing it in one view, if it's an artifact, you're not going to see it in another view. So that's it. Again, those are the references, extremely useful to look at. I hope you found that useful. Thank you very much indeed.